Good afternoon, everyone. We are H40, and we're here to minimize your efforts in order to maximize your health. Have you ever wondered what it would be like to be one of those people you see on social media or TV who are healthy, good-looking, living a healthy lifestyle? Have you ever thought that living hard is a hard commitment? What if I told you that we have created an app that allows you to live a much healthier lifestyle with minimum effort? We have created an app designed to collect and interpret health attributes such as your daily fitness, rest, and nutrition. The app also stores medical information that can be provided to your doctors to assist you towards a more accurate diagnosis. Through this presentation, we are hoping to attract investors with whose help we intend to spread an easy, healthy lifestyle change for everyone. In this presentation, we will tell you a little bit about our app, our target audience, our financials, and our timeline of work. And now I'll hand you over to my wonderful team, and they'll tell you a little bit about us at H40.
Well, of course, you must be wondering, isn't it like any other app that tracks your calories and encourages you to get those 10,000 steps a day? Well, no. H40 is devoted to understanding your health as a whole, your past, present, and future. Studies have shown that the number one reason why most fitness and nutrition apps have proven to be inefficient is because their customers fail to insert information of their daily activities. It's just not fun and it's not a habit. We recognize how precious time is, and our generation just needs things to be done for us. That's why we have made things simple. We have turned all these apps into a single running independent app, H40. All it requires to get to know you better is access to your previous medical files through your ID. Once it has that information gathered, H40 can analyze your medical files and create a profile based on your unique information. We have divided our services into three parts: the smartwatch, the app, and the website. The smartwatch can read basic information on your heart rate, your steps, but also, most importantly, it sees if you're meeting up to daily suggestions for your physique. And if you're not, it's okay. It will give you suggestions on how to meet your realistic goals in a healthy manner. The mobile app is where users can manage all their information. You can have access to all your previous medical checkups, hospital check-ins, in summary, anything you have ever done in a hospital through this app. We also use this information to take care of your future. So for example, if in your previous blood draws, you have proven to have a low potassium rates, the app can recognize that and give you suggestions on how to increase your potassium rates with a simple gesture as eating a banana. The app can also detect the core of your problems with any abnormality on your recent exams, and it can show you exactly what type of doctor you can look for, and you can also book your exam with your doctor through the app. After you've chosen your doctor, with your authorization, the doctor can use the website as his main tool to access your medical profile and have access to all your daily information too, and will help him and you get a more accurate diagnosis as to where to treat you. Any further exams you take will automatically go to H40 profile. And this is how the app works.
So as soon as you download the app, you're going to get this screen. You're going to have two options, either to log in or to sign up. As soon as you click the sign up button, you're going to have to enter your basic information. But here's the fun part. As soon as you enter your basic information, you're going to have to enter two numbers, your ID number and your insurance policy number. Those numbers are the ones that are going to allow us to have access to your previous medical information in order to analyze it and provide clear results and successful results for your health in the future. As soon as you've done that, you're going to have access to amazing feature our app offers. For example, we'll be able to track your daily activity and provide results each day. We will be also able to gather up your previous exams and the dates and provide you with a clear analysis and be able to contact your doctor about it. As my colleague previously said, you're going to be reminded about positive changes in your health in order to improve it. And finally, you're going to be able to set up a checkup with your doctor or an appointment in just one click away. The system was thoughtfully designed altogether to serve all generations. However, our starting target is Generation Z.
Our target audience focuses around all generations. However, since the biggest users of technology in today's society is Generation Z, for those who do not know, it is the people who were born between 1990 and 2003. They are the biggest users of technology because of their use of their phone for boarding passes, credit cards, daily reminders, and many more. However, since this app is beneficial to all generations because of its easy access, the way it collects data automatically, having no need to do it manually, and its simplicity to navigate. Our competitions focus on features of several different apps. Many of you have probably seen or used these apps before to track your heart rate, your fitness, your medical, your diet, or your sleep schedule. However, our app has combined all of these features along with many more to have everything you need to improve your daily health underneath one application, making it the most logical and simple decision when it comes to choosing the proper health app. You may be wondering how we're going to make this possible. My colleague will now talk to you guys about the financials of the app.
Our initial investment required is $150,000. This will mostly be used to buy our intangibles, which is the software we're using for the app and the website, and purchasing tangibles to create our app and the website, which will be shown to the customers. For the subscription, customers will get 3 months for free when downloading the app and subscribing to our website. And after those 3 free months, we will require you to only pay $39.99 a year. So these 3 months actually are for the customers to get the experience of how we work and how we can make your life easier and healthier. We will be trying to expand to all major platforms, just as Apple App Store, Google Play Store, and Fitbit. And you may be wondering, how are we earning the money? First of all, our cost of the product is $30,000 all around. And by our calculations, when we sell it to 750 people, we'll be able to cover our $30,000 cost, and then after that, all future sales will be profit, which 20% of all our profit will go to a charity called Esperanza.
H40 recognizes that the access to good medical help should be a right for everyone. Therefore, we are proud to say that we are proud to help Esperanza in this commitment to spread health to the world. They are a charity organized by volunteer doctors and nurses to supply medical help to countries in North, South, and Central America, and also Africa. Well, what do they need? They need resources to buy their medical supplies and medicines to reach out to a greater spectrum of people. H40 will be helping Esperanza by donating 20% of our profits to the charity, and also making our system available for the volunteer doctors and their patients to be able to track their health in a long term.
Like any other startup company, we're starting small but we're dreaming big. In the startup time, we're going to be able to plan, structure, and promote the project. On year 1, we'll be staying in London, which is the main spot of our project. We will be advertising through local newspapers, we're going to be purchasing online ads, and through the doctors who are going to be promoting and supporting us. As my colleague previously explained, our initial customers are going to be Generation Z students. In year 2, we're going to be expanding to all of England and places in Europe like Germany and France. We're going to be able to have partnerships with both private and public hospitals and companies which are similar to ours, like Fitbit, Best One, and Samsung, between others. In year 2, we're going to be able to finally repay the investors. Year 3, we're going to have official support from both governments and hospitals. The hospitals will be required to install our software in their technology. We'll be expanding to both North America and all of Europe. And we will finally reach our top partnership, which is Apple. In the final year, we're going to be selling 40% of the company. This will allow us to grow and to finally be able to call us a global company.
So, to sum up everything, we have shown you how the app works, explained to you our target audience, told you how much funding we're asking for, and presented you with a timeline of our work. What we have come up here with essentially is an app designed to collect and interpret health attributes such as your daily fitness, rest, and nutrition. This app will store your medical information and provide your doctors with all the information to assist you towards a more accurate diagnosis. So in order to conclude this presentation, I must ask you one question. As a student, would you like to live your life healthier with a minimum amount of effort? Think of it as a way not only to help you, but help the people around you. Don't wait until you're 40. Install H40.
Practice